Hello, everyone. My name is Azza Mustafa. I am the postdoctoral fellow at the Institute for Humanities in Africa, University of Cape Town. My talk today is about the digitalization of healthcare in Africa, the case of Babyl, Rwanda. So there is an article that was posted on the Financial Times titled Rwanda Venture Test, Digital Health Potential in Developing World, by Andrew Jack, who is a global education editor for the Financial Times. And quoting him, he said, while digital tools can potentially support more people affordably and efficiently in stretched healthcare systems, critics have raised concerns about unequal access and say that claims about digital tools such as artificial intelligence can be overhyped and unproven. He also went on describing the digitalized medical healthcare service provided by Babyl Rwanda as a more rudimentary form of telemedicine. Of course, his statement shows some kind of a technological deterministic views, and I will explain why. So the current technological revolution in Rwanda is shaking off the negative image of the 1994 genocide. Shortly after the genocide, the government of Rwanda, led by Paul Kagame, launched a set of economic reforms. One of these reforms is Vision 2020, which is an economic blueprint to attain a knowledge-based economy. Rwanda's different economic strategies acknowledge ICT as key to economic development. For example, the National Information and Communication Infrastructure Plan, which is implemented through 3 phases from 2000 to 2015. In this plan, the telecommunications sector played a key role in the digitalization of healthcare by supporting startups that provide access to digitalized primary healthcare via mobile phone. So in this presentation, I'm going to focus on Babyl, Rwanda, which was a startup that's a subsidiary of Babylon Health, a digital healthcare provider company based in the UK, founded in 2014 by Ali Parsa, who is a former investment banker who became one of the prominent figures in the healthcare entrepreneurship. In 2016, Babylon launched Babyl with the financial support from the Ministry of Information Technology and Innovation in Rwanda, and also from the Bill and Melinda Gates Foundation. So what Babyl provides is medical health services for primary health care. So mHealth, or mobile health, is the medical and the public health practices supported by mobile devices, such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices. Here I'm going to focus on the mobile phone for primary health care. So the mobile phone penetration in Rwanda is estimated over 75% for feature mobile phones and 15% for smartphones. So when Babylon took the mHealth technology to Rwanda in 2015, they already had developed a smartphone application, which includes intelligent symptom checkers, chatbots, which go through like millions of coded symptoms, and also booking virtual appointments with medical professionals, creating also medical history reports, providing further testing and examination referrals, and prescribing and home delivery medication. So the question is how a smartphone application developed in the UK is reconfigured to adjust the healthcare circumstances in Rwanda. So what Babyl did two things. The first thing, since smartphone penetration in Rwanda is extremely low, so they launched, of course, the smartphone application, but besides that, they also launched an mHealth service based on USSD technology. The mHealth service is is processed by dialing 811 and registering for the services with the national ID card that was used when purchasing the SIM card. Then the ID will be subjected to verification, and after the verification and before booking the appointment, the patient will pay a fee that for the calling service using mobile money. And shortly they will receive an SMS confirming the appointment and then receiving a call from healthcare professionals. It was usually a triage nurse who will decide the severity of the condition before advising for the next step. So upon the condition of the patient, the nurse will book an appointment with a GP who decides to prescribe medicine from a partner pharmacy or request further tests from a partner laboratory. So then the second adjustment was regarding the work conditions of the medical professionals, Babyl included. So in the UK, medical doctors can give their consultations from their homes where they have laptops or PCs and also the internet access, of course. But in Babyl, medical doctors operate from a call center. And healthcare professionals are also familiar with the local context and the language. So, I mean, Rwanda has an incredibly open policy that facilitates the adoption of smart technologies. For example, when the first case of COVID-19 was identified, the country applied technology to combat the pandemic. They applied artificial intelligence and robotics in hospitals for patient management and data recording. Drones are used in broadcasting information regarding the situation of the pandemic and also communicating the prevention strategies and protocols. Geolocalized hotspot mapping was used for tracking contacts. Testing is accessed through mobile phones using USSD services by dialing 114, and thermal scanning cameras and other digital tools were used for surveillance. So back to the statement by Azza, was saying, digital services or the digital services provided by Babyl are more of a rudimentary form of telemedicine, which implies there is no trace of artificial intelligence. Artificial intelligence is really somehow an overrated kind of statement made for attracting international donors. However, there is a definition of intelligence itself, by Joanna Bryson, and she says that intelligence is the capacity to do the right thing at the right time. It is the ability to respond to the opportunities and challenges presented by a context. This simple definition is important because it demystifies intelligence, and through it, it demystifies artificial intelligence. So it clarifies both intelligence limits and our own social responsibility. And also there is Nili Ochon, who says that the transformative quality of technologies is not a natural capacity of technical devices, but it is more attributed to socio-cultural context they operate in. Technology only works in heterogeneous networks in which people, organizations, knowledge, skills, and technological objects interact to produce a specific practice of work. So this is, of course, not to say that we can't raise the question of digital divide, looking at the unequal access to healthcare services, but let us consider it as an invitation to think from a different perspective, especially this is a research that is really at the beginning, and yeah, it's just at the very exploratory phase, and of course I need to do more research about that. But I would say that smartphone application doesn't necessarily provide intelligent solutions for stretched healthcare systems. But we think of the technology as an agent that is contextualized and customized to our circumstances, which responds to the opportunities and challenges. Then this is an intelligent solution. So I think I will stop here, and thank you very much for listening. And I'm looking forward for questions, remarks, and comments. Thank you very much.